Hello everybody, hope you are doing very well today. Hope you are having a nice day. So on today's episode of health tips, we are going to be talking about a very interesting topic that concerns mainly my ladies. So I'm Dr. Rabi Labaran Nangambo, and I'm going to be bringing you some health tips depending on what I decide to talk about, or depending on what you want me to talk about. So, who can guess what we'll be talking about today? Okay, so today we'll be talking about a very interesting topic, and we're going to be talking about vaginal discharge. So, yes, this video is for my ladies. So, I decided to talk about vaginal discharge because one in three consultations every day, females come for problems, itches, abundant discharge, and every lady, every woman has vaginal discharges. Depending on where they are in their cycle, they are going to have different types of discharge. So today I'm going to be talking about vaginal discharge, what it is, what is normal, what is abnormal, and I'm going to bring in this knowledge so that we can know what is abnormal. So when we get to the point where we feel like we're having some abnormal discharges, you know when to meet your doctor. Okay, so we'll start with what is vaginal discharge. Vaginal discharge, firstly, is normal. Normal. Now, when it's accompanied with other symptoms or there's a change in the color and the smells, then it can be a sign of infection. So we are going to start with what's normal. Normally, every lady has vaginal discharge because vaginal discharge is produced. There are fluids that are produced by the female reproductive tract, and these fluids usually contain cells and healthy bacteria, because it's what is known as the normal flora of the vagina. That is, there are some healthy bacteria that are in the vagina that helps to keep the vagina moist, helps to keep it lubricated, clean, and also helps to prevent infection. So vaginal discharge is this fluid that is being produced by the female reproductive tract. That's the vaginal, the uterus, the cervix. And so this fluid comes out from the vagina, and every female has vaginal discharge, so it's normal. So when you go to the hospital and the doctor says, do you have vaginal discharge? Yes, of course, you have discharge. But what we usually want to find out is if it's abundant, if it's abnormal, and if it's accompanied with other symptoms. So, what is normal? Usually during your cycle, like from the time you see your menses to the next time you're going to see your menses, is what we call a cycle. And you can have a 28-day cycle, you can have a 21-day cycle, you can have a cycle between 21 to 27 days. It depends on from the first day to the next time you see your menses is known as your cycle. So vaginal discharge, your discharge is going to change depending on the time or what part of your cycle you find yourself in. For example, immediately after your menses, after seeing your menses, you will notice that your discharge is going to be brownish, a bit brownish, reddish. Yes, because your uterus is still shedding the lining, so it's not going to be as clear as normal. Now, after your menses, you're going to notice your discharge will go back to being whitish yellowish, and it's going to have an odor, but it should not be very strong, it should not be offensive. So your discharge can have a smell, an odor, but it should not be offensive, it should not be extremely pungent. Yes, that's it. So now another time you will notice a change in your discharge is during your ovulation. For those who have a 28-day cycle, your ovulation will most likely be on the 14th day, and you'll notice that your discharge will become more watery, it will become sticky and slippery. A good example of what all of us can relate to is the egg white, the whitish part of the egg just before you boil. So that slippery nature, sticky, is what you're going to realize at your ovulation period. Now, after ovulation, your discharge will go back to being whitish, yellowish. There's no specific color, but somehow between whitish, yellowish, cloudy. And as I said, it's normal, especially if it's not accompanied with any signs, any offensive odors. So now that is normal. So it's normal to have some degree of discharges not accompanied with any symptoms or any smells. Now I would like to explain some different colors that could be signals of infections, or some different symptoms that you can have that will make you think that, oh, probably something is wrong. The first thing, one of the most common ones that most ladies, 3 in 4 ladies, are going to have in their lifetime is what we call the Candida albicans. When you have an infection, a Candida infection, commonly known as sugar, yes. So you'll notice that your discharge will become yellowish, thick, and will be clumpy like cheese. Most of us know cheese, right? It's going to be like cheese, a cheesy discharge, and it's going to smell like stale yogurt. So you'll notice that your discharge is going to change. It's going to be abundant. It's going to come out clumpy, like cheesy, like when you cheese. You have cheese in your hands. Yes, that's how it's going to look like. It's going to smell like stale yogurt. So then it's a sign that you probably have an infection. You probably have a candida infection, and you need to see your healthcare practitioner. The next thing is if you notice that your discharge has become gray, a bit grayish, darkish brown. And as I said, usually what makes you understand that there's a problem is that you have accompanying symptoms. If you have just abnormal vaginal discharge, most times for you to think of an infection is going to come with other symptoms. Now for the grayish discharge that you're going to notice, it's going to have a fishy smell. We all know the smell of fish, right? It's going to have a fishy odor. Like when you remove your pants, you're going to be hit with this fishy smell, and it's going to be grayish. And it's also going to have other symptoms. You have this burning, itching, and usually you can have pain on urination. This is a sign of infection, and it can be an infection with trichomoniasis. That's a type of infection. We don't need to bother about that. Now the next thing is yellowish greenish discharge, and this yellowish greenish discharge also has a very offensive odor, and usually you realize that you have itches, you have burning, you have this burning sensation when you're urinating, and also you can have pain during intercourse, you can have pain during sexual intercourse. This is a sign that there's an infection, and you need to see your healthcare practitioner. Probably they'll run some tests, or they'll give you some treatment. Okay, and now okay, another thing to always try to look out for is if you notice that your discharge has changed, you need to check for other accompanying symptoms like what I just stated. One of them is that burning sensation. For the first one, where you have the cheesy discharge, you'll notice that you have severe itchy, sometimes redness of your vagina, of the vulva, and you feel pain while urinating. So all of these are abnormal. Anytime you have vaginal discharge that you notice that it's not what you usually have, and it accompanied with symptoms, you can also have lower abdominal pain, pain in your lower abdomen, like severe pain in your lower abdomen. It's important that you go to see your doctor so that they can give you treatment. You can do tests to figure out what exactly is wrong. Now the next important thing I would like us to know, ladies, is if you're sexually active, it is of utmost important that you take treatment with your partner, because if you are treated and your partner is not treated, it's a vicious cycle. Your partner is going to reinfect you. And one of the things that we need to know, ladies, is that most men do not have symptoms when it comes to sexually transmitted infection. Most men will not have symptoms. So your man will be asymptomatic, he will be fine, while you, on the other hand, you're going to have symptoms. So if you go to the hospital, they check, you run some tests, they say you have a sexually transmitted infection, you have to take treatment with your partner or partners, so that you do not reinfect yourself. So important to note is every lady should know what is their normal, so that when there is abnormality, you can easily detect. The next thing I would like to answer is home remedies for treatment if you figure out that you're having some infection, some changes, some itches, some burning, some pain. Now I do not know about these home remedies, if they work or not, But my advice is, if you notice abnormality, you should go to see your healthcare practitioner, you should go to see your doctor, because one of the complications of infections, of sexually transmitted infections, or vaginal infections, is sterility, infertility, that's inability to have children. Because when you have these infections, they can cause some kind of scarification on your tubes, and therefore prevent implantation. Like when the egg has been fertilized by the sperm, is going to prevent it from going into the uterus where it's supposed to be. So it's of utmost importance, ladies, to get treated if you think you have an infection. Please do not stay at home months after months trying home remedies, especially if it's not working. You need to see your doctor. Also, if usually infections mostly come with sexual activity. So ladies, again, if you're having multiple sexual partners, you need to be careful. For single ladies, maybe try abstinence, or if you must absolutely meet with someone who is not your husband, it's important that you use protection. Another thing that we see frequently in the hospital is that ladies have unprotected sex with their partners who are not their husbands, because they feel that he's clean, he takes care of himself. No. Sexually transmitted infections are not written on the face. Your partner can be clean, can be organized, can be whatever he is, but he still has a sexually transmitted infection. Same with the ladies. So do not have unprotected sex with someone you're not married to, because you do not know the person's lifestyle. It's going to prevent you from a lot of headaches. Now we're talking about sexually transmitted infections, but there are other infections too, not necessarily the vaginal infections like HIV, like hepatitis. So I hope we learned something. I hope I gave a summary of most of the problems that we are having. I'm looking forward to your comments, looking forward to your questions. Leave them in the comment section and we're going to see how to answer them. If you have a particular topic that you really want to learn about, you can leave it in the comment section, and I'm going to do my research and do a video on it. Thanks very much for everyone who has watched this video to the end. Looking forward to your likes, to your comments. Thank you so much. Have a nice day. Until next time, we'll come again with the next healthy video. Thank you.